Welcome to MedWise. Here we break down stories on legal and ethical issues in health systems that affect everyday lives. If you care about healthcare and the future of our communities, hit that subscribe button right now. Today, we're asking a big question. Who should lead Nigeria's primary healthcare facilities? Nurses or community health practitioners? Imagine this. A pregnant woman walks into a primary health care center in rural Kwara State. She is in pain, anxious, and in need of urgent care. But instead of being welcomed into a team united for her health, she walks into a heated argument. On one side, nurses insist, "We are the ones who stay by the patient's side, caring through the night, assisting in childbirth, giving medications, and counseling families. Without us, hospitals and clinics cannot function. Should we not lead?" On the other side, community health practitioners respond, "We are trained specifically for the grassroots. We diagnose and treat common illnesses. We coordinate immunization, maternal and child health, and we are empowered by law to manage primary health care facilities. The system was designed for us to lead." The patient is caught in the middle, confused, wondering, "Who will help me now?" This is not just a story. Situations like this have happened in different parts of Nigeria. The rivalry between nurses and community health practitioners over who should head primary health care facilities has become a recurring conflict. But today, let us settle the matter once and for all. If you were the one in charge of Nigeria's health system, who would you appoint as the head of a primary health care facility? A nurse or a community health practitioner? Drop your answer in the comments before we continue. According to the Nigerian Scheme of Service 2013 Revised Edition and the Standing Orders for Community Health Practitioners 2012, the mandate is very clear. Community health practitioners are empowered to diagnose and treat common illnesses, to provide preventive, promotive, curative, and rehabilitative services, to coordinate immunization, maternal and child health and family planning programs, to mobilize communities for health action, and to manage primary health care facilities. The law recognizes them as the rightful heads of primary health care facilities in Nigeria. Nurses, on the other hand, are equally vital, and their scope is also defined in the Nigerian Scheme of Service 2013 Revised Edition, pages 91 to 102. Their responsibilities include providing direct nursing care to patients, such as monitoring vital signs, administering medications, and offering supportive care. They assist physicians in treatment procedures, surgeries, and clinical interventions. They deliver maternal and neonatal care, especially in collaboration with doctors and midwives. They conduct health education and counseling for patients and families. However, by law and by training, nurses are not empowered to independently diagnose or prescribe treatment, and they are not designated as heads of primary health care facilities. Their work is indispensable but complementary, not managerial at the PHC level. So why do clashes keep happening? The answer lies in professional rivalry. Some nurses, perhaps out of passion or misunderstanding, step beyond their legal mandate. But should health workers be fighting each other for power, or should they be uniting for the people they serve? When professionals clash, who really suffers? It is not the nurse. It is not the community health practitioner. It is the patient, the pregnant woman in need of care, the child waiting for immunization, the elderly person needing health education. Rivalry weakens the system. Collaboration strengthens it. Let us not forget history. After the Alma-Ata Declaration of 1978, Nigeria faced a major health crisis. Doctors and nurses largely refused to serve in rural areas. Villages were abandoned. Healthcare was collapsing. That was when the community health practitioner profession was created. They were trained to live with the people, serve the people, and bring healthcare right to the grassroots. If not for community health practitioners, Nigeria's primary healthcare system would have collapsed long ago. That is why the law recognizes them as the rightful heads of primary health care facilities. Now imagine a conversation at a PHC. The nurse says, "I have been trained to care for patients, to monitor them closely, to support them in times of need. Without nurses, there is no care. So why can't I head this facility?" The community health practitioner replies, "And I have been trained to diagnose, to treat, to manage health programs, and to lead health teams at the grassroots. The law empowers me to head primary health care facilities because that is my mandate." It is not about who is better. It is about who is designated. The patient then speaks up. "All I want is care. Does it matter who leads if both of you cannot work together?" The patient is right. The fight for power distracts from the mission, saving lives. So is this about professional pride or about the people we serve? If health workers truly put patients first, rivalry must give way to teamwork. Doctors, pharmacists, laboratory scientists, nurses, and community health practitioners are all essential links in the same chain. Each has a role. Each has a calling. Problems begin only when one cadre tries to dominate another instead of respecting boundaries. The way forward is clear: ethical practice, mutual respect, and teamwork. The patient should always come first. Collaboration must come before competition. Respect must replace rivalry. By law, community health practitioners are the rightful heads of primary health care facilities. Nurses remain indispensable professionals, but their mandate does not include PHC headship. And the health sector can only progress when every professional embraces humility, respect, and cooperation. Do you think these rivalries are damaging our healthcare system? What do you think is the best way to build respect among health workers in Nigeria? Share your thoughts in the comments below. Your voice matters in this conversation. Thanks for watching. Remember, healthcare is about saving lives, not rivalry. Drop your thoughts in the comments, share this video, and don't forget to subscribe for more conversations that matter. Until next time, stay informed, stay healthy, and let's keep building a better Nigeria together. Collaboration is stronger than rivalry.